Ghana Health Service and the Christian Health Association of Ghana, they are investigating circumstances that led to the death of this 9-week-old baby at the St. Gregory Hospital at Kaswa. The baby is said to have died after a doctor at the facility pulled the plugs of an oxygen machine on the baby because the family could just not afford some 530 Ghana cedis. Well, let's bring you that story, and then we'll have a great conversation on the subject and what the advocates really are saying.
Prosper's father, Kennedy Kwao, explaining why they chose to give that name to their son. But that blessing has been cut short. Prosper was born on January 19, 2018. His mother, Sefa Ako, said her child became ill and was sent to the hospital on 5th March, but died 3 weeks later.
Baby is sick on Thursday evening. Friday morning I took him to hospital. He's not breathing well. Admitted. They give him blood. So the doctor say they will transfer us to Kolebu on Monday. But the bill they give us is 533 before we move to Kolebu.
Sefa Ako tells me she was looking forward to her son's quick recovery, but that never happened. He died after doctors at the hospital pulled the plug on the oxygen machine Prosper's life depended on.
When I call my husband, I won't get him. His phone is switched off. So that Saturday, the doctor came. He said, I hear from my husband. I say I didn't hear. So he removed the oxygen. That Saturday, he removed the oxygen. Even at 6 o'clock, the baby is not breathing well. I'm crying. The nurse come and put the oxygen. So it's too late.
Sefa Ako said, although she had 2 other children, the memory of losing her son because of money is painful.
It's difficult for me, but so bad because of money. That is why. If I have money, I can't go like that. But I didn't have money. That is why. I want to put the baby on the mortuary, but me, I refuse.
Why?
Because I feel I lost the baby. When they put in the mortuary, I'll come and pay before I'll collect the baby. That is why I refuse him to put on the mortuary form.
Kennedy Kwao says he tried to engage his employers to advance him a loan to cover the bill, but the money came too late.
I was outside Accra when I made a phone call back home and learned my son had died. My wife could not reach me because of bad mobile phone reception. In fact, I was broke. I had only 20 cedis on me.
That day, Miss Kanya bought me 20 cedis.
Administrators of St. Gregory Hospital, where the incident occurred, have declined comment on the matter, explaining the Central Regional Health Directorate is investigating the issue. Jojo Kobna, JoyNews.
And following all the concerns raised, not only by the public, but also the media and the health authorities, we're told that the investigations have started. The Ghana Health Service will be speaking to us as much as possible. We'll try and have the Director General of the Ghana Health Service, Dr. Nsiasari, on the line. And then we'll have some interview with the Christian Health Association of Ghana as well. But we have in the studio an advocate, somebody who has been working in the industry for over 17 years, Executive Director for Hope for Future Generations, Cecilia Senoo. Good morning to you.
Good morning.
And we're thankful that you decided to accept this interview to be with us. But
thank you.
Throughout your experience, 17 years working in this sector, in this industry. Have you encountered such cases similar to this, what we witnessed at the hospital?
Thank you very much. I haven't, but in the communities, because I'm a civil society person, in the community, interacting and talking with community members, some of them have that fear of going to hospital because, one, they talk about attitude of the health people. Two, they talk about money, especially if you don't have the national health insurance. Even if you have the national health insurance, you still have to pay some money. And so you see conditions of people in the community, you recommend that they go to hospital, and some of them decline. You see pregnant women, because health staff advocate for people giving birth in the hospital. You talk to them, they prefer giving birth at home, maybe a traditional birth attendance, because one, money; two, because attitude. So it's in the community, but where you see that the person is, a child is sick and going to die, and you don't want to rush to hospital, it's very uncommon.
But logically, what should a health personnel do? A decision has to be made at some point.
Yeah.
When a patient can't pay for health service delivered.
You know, we are talking about universal health coverage. Yesterday, Ministry of Health and WHO really launched the universal health coverage week or day. Universal coverage means people should have access to health. Financial issues shouldn't be something that will prevent people from accessing health. And so equity is necessary. But as a country and as a health system, we should not prevent people from accessing health because of money. So listening to the story from the woman is rather unfortunate. If this woman or if this child died because of money, I think it's something we should look at. I also agree that fine, hospitals must run. But as a Catholic hospital, I know Catholics already have that kind of social support for needy people, people who cannot afford. They have been doing that. I have worked in the Catholic hospital before, and 50% or maybe about 40% of people who cannot afford health money or health service is still giving that free support by the church. So I'm surprised listening to what the woman said. If it's really true, then the whole country must condemn, and the doctor must be brought to book, because it's unacceptable. It shouldn't. It's a human right. It's a child who cannot talk. So because children cannot talk, adults take decision for them. It's rather unfortunate, and it must not be encouraged at all.
Well, we do understand the concern we raise since this story was broadcast and brought to the media. But I'm reading the Code of Ethics of the American Medical Association. It says that doctors at no point in time should refrain from giving care and taking the right decisions in the interest of the patient.
Yeah. So the patient is your priority. It is not you. It is not your values. It's not your.
Well, that's America.
Well, that is America, but we all have the same blood. We are all human beings.
In Africa,
yes,
the conditions in which these medical facilities operate are not good. You do understand that, don't you?
I understand that our health system have problems, but we still survive. We must still provide what we do, because the medical ethics doesn't give you that leeway to do what you want to do. It's the same. The ethics is the same. We learn a lot of things from the developed countries, and we try to follow some of the things that they do. We know that Africa, we have problems. We have problems in the health sector. The services that you get, the attitude of the developed countries is different from what is happening in Africa. But my biggest problem in Africa, communicating health issues to patients, is a problem. You see, we assume that the patient doesn't know anything. The patient doesn't have any right. The health person, the doctor, the nurse is the only one who has the right. You see, the woman is talking. If the doctor were to explain all these things, every stage to this woman to understand, even if it's a health problem, and the doctor explains this to the nurse, to the patient or the mother of the baby, she will not come out saying this, because no woman will want to lose a child. And it is so sad listening to the woman. I am a mother. I cannot imagine one child or my child dying because I cannot afford to take care of. It's unacceptable.
Okay, so the doctor should have insisted, or perhaps taken what you call an ethical decision to keep the oxygen on the child.
Yeah.
For how long? And who pays for that oxygen refill?
I think it's coming back to money again. And like I said, we are all not equal. The Sustainable Development Goals is saying that leave no one behind. Leaving no one behind means that equity, access, and all those things, affordability. But like I'm saying, that is why we have social welfare. Every hospital, children, are they supposed to register for national health insurance? I think we have some exemptions. And these exemptions, these are young up to 18 years. And this child is supposed to be exempted from that. And so if we are saying that because the mother or the father couldn't afford, so we kill the innocent child who cannot talk, who cannot beg, who cannot plead, then there is a problem. That's why I'm saying that the medical ethics doesn't allow that. The life of the child, the life of the patient is your priority. And so if you are saying that 2 hours or 3 days, 4 days, I cannot afford, then what is our business? There are several times, Ghanaians usually, we are naturally kind people. You dip your hand in your pocket and give to people, don't you? And so we see it as one of those things. If the child is the doctor's child, will that happen? It will not. So it is ethical issue. And I mean, if it is true, that's why I'm saying that we are still investigating. I mean, Ministry of Health is investigating. Catholic CHAG is investigating. We are waiting for the final report on this, and then we take it up. It's unacceptable.
When you go to many rural communities in our country, there are times that our reporters have been on the ground, and myself I've had great experiences in this, in which the people have to trek several kilometers just to access health.
Yeah.
And even the transportation mediums available for that patient to go to that place. By the time the patient gets to the hospital, which even may be in a poor state, may be poorly funded, that patient may be in a terminal stage. What do you expect a medical doctor to do?
You see, that is why we have different levels of health system. You see, we have the community level, we have the primary level, we have the tertiary, different levels. You know, that is why we are talking about the cheap compound, the cheap facilities, the level of the community. If you are sick and the basic health services can be given to you at your community level, it might be that it's not a serious condition. If we don't have well-equipped facilities at our cheap compounds, that is why people will die, because the basic services that you are supposed to get, you are not getting it. So you are thinking of going to the tertiary. You are looking at coming to the district, coming to the region. I mean, it is not the best. I heard previous government talking about equipping the community level health systems. Now, that is what current government is talking about. Are we just saying it, or we are really investing into that? For me, I know that, and I continue to advocate for promotion, preventive, and basic health. Basic health means that little things that you can do to save your life, to stay healthy, must be promoted than waiting for people to fall sick. And basic health goes, and it is the cheapest. If community, everybody know that if I wake up, this is the type of food I should eat, this is the life I must live, my environment, why do you fall sick? So we are not doing well in investing so much into preventive health. Preventive health is giving power to the community, individual, to take decision. I mean, nurses and doctors cannot take decision for me. I must know my role, because I have a bigger role to play when it comes to health.
And in this instance, you are saying that what? The patient who is a child, whose parent needed to take the decision, should have been better communicated to.
That is what I'm saying.
On what front and on what ground?
You see, they are human beings and they have right to information. They must know if I'm sick and I come to hospital, I must know what is causing what my sickness is. There is no need saying that, oh, hide the sickness from me. Let me know why I'm sick, so that I can take decision and tell me that it is because of ABCD, that is why you are sick. Let me give an example of malaria. If I have malaria, it is because I have exposed myself to mosquito bites. You understand? And so if I come to hospital and you treat my malaria, and you don't tell me that because you have mosquito, the mosquito that transmits the malaria, that is why, so try to sleep under mosquito net. I will continue sleeping outside without the net, and I will continue coming to the hospital. So that is why I'm saying that the explanation and communication, this woman, if she were to know that, oh, my child's condition is something that maybe he will not survive or something, and you have to do, it is only God that can do this.
Was it possible that the patient was in a terminal stage, and so we have the influx of a lot of patients, and some decision needed to be taken by some health personnel at the facility to save enough oxygen for the next patient? After all, this patient was in a terminal stage.
How do we know that he was on the terminal stage? Terminal stage is that you are getting to your death. The condition is 50-50.
Well, you never know. That could have been a possibility. Why do we have to chastise a health professional for taking a decision?
It can be. We are all, we are just, it's assumption. Because still, the clear communication has not come out. You see, we are all talking about it. What has killed the child? Why was the oxygen removed? We just need clear communication. We don't want this so that we talk about it, and we don't want it to happen to any child again. Children have right to life, just as adults have rights to life.
Well, we do understand that, but the medical professionals also need to take a decision in the interest of the patient, but also knowing that they have the knowledge to do so. Is that not why we're all arguing about this? It's more like the argument on this subject is becoming more of a moral and ethical issue than anything else.
I agree. You know, doctors, nurses, they understand.
We don't think they can take the right decisions at the end of the day when it comes to providing service at the end of the value chain.
They can take the right decision, but the decision they are taking should save life. I mean, who are we to kill people? Why should you? You understand?
You are saying that who are we to kill people even at the terminal condition of the patient, even if that's the situation, not even relating to this instance?
You don't need to kill. I mean, you cannot. You don't have the right to
go to the last breath?
You have to when necessary. You must seek consent from the patient. You see, this is a child, and the child cannot take decision. The mother's consent, the father's consent must be sought. You don't take this decision for the child. This is what we are saying.
Well, so now let's speak to the Director General of the Ghana Health Service. And Dr. Nsiah-Asare is on the line. Good morning to you, Dr. Nsiah-Asare.
Good morning, sir.
And we're happy that you've been able to grant us this interview. But for all the things that have been said following the story that has been brought to the attention of the public by the media, and especially as we look at it at JoyNews, what will be the position of the Ghana Health Service on the subject?
Our position is very simple. Let's be good, but very simple. Ghana Health Service position is very simple. Immediately we heard it, we set up a team on the region to go and find out what actually happened. And the team went there yesterday, immediately we heard it. And the team will come out with a comprehensive report. They've been briefing me, but since it's not complete, it will be difficult for me to divulge whatever they told me on the news this morning. So what I will beg everybody is that let's be very patient, and you should rest assured that whilst all of us are the helm of affairs, we make sure that we deal with this case and conclude it as quickly as possible, and then we let the public know what has happened. Apparently, the hospital is, I think it's a Catholic hospital, the Christian Health Association of Ghana. They are working closely together with the Archdiocese of Cape Coast. They are working closely together with the Christian Health Association of Ghana, and the region, the district, and then the regional directorate of the Christian Health Association of Ghana, and the national directorate. We are all working closely together, and we will come to the end of it and of what actually happened. So that's what I'm going to keep everybody patient. Whatever anyone is saying will be speculation. The people have spoken, we have held the case, we sent it to the ground to find out if actually the oxygen was stopped because of money, or what actually happened. Was the patient on oxygen? How long was he on the oxygen? clinicians should also go there and go and find out if the treatment that they give was in accordance with the normal treatment guidelines. But what I will tell everybody is that in hospitals, we are bounded by the patient charter. We also are bound by the responsibilities of the physician and the responsibilities of the patients. We have complaint desk. We have management in every hospital. So if you go to any hospital and you have a problem, just walk to the management of the hospital. They will listen to you. We train them to do that. And once you go there and you think that you don't have the satisfactory answer to your question, you can go to a region or the district, or better still, you can even write to us and we take the necessary action. We are taking our staff and everybody in the hospital, the management, the staff, through what you call continuous quality improvement courses and then training. We have assurance unit at the hospital. The bigger hospital is even a bigger unit to somebody responsible and somebody who is employed to really look at quality issues. So it's work in progress. We are continuously improving our quality, and we will continue also having good customer relations and customer care. We are in the hospital and in the health sector because of patients. If the patients are not coming to hospital, the hospital will close down. So I will teach everybody that when you go to hospital, you have a right. The one who is also looking after you also have a right. So let us work together to improve the quality of care in this country. And I want to take a press also to help us. We will also sometimes come out with some of the good things that we are doing in the health sector. There are a lot of those good things that which is happening in the health sector. I know we always say that bad things fail. But for example, if you look at what happened with the Lassa fever outbreak, I think about that day now, we contain it as quickly as possible. If you hear about that, and one at the Kumaka, people going home and all these things, they went home and everything, but we contain it within the shortest possible time. Even though the Lassa fever, one life was lost, but we were able to make sure that nobody else died from Lassa fever, especially where it happened at Tema General Hospital. The same thing at Kumasi Academy. So please, take us together. We will engage the press very soon, and we talk about all these things. And I'm happy that we have brought it out and we are asking questions. And I think that's the way to go. But our encounter with the press, and especially the patients, also should know what they're supposed to do. Lucky health insurance is in Ghana, but I also tell everybody that everyone who has health insurance card, so that all these things that they are giving me this, and they said that I should go and bring money and all sorts of things is not there. Yesterday was well healthy. The team was not universal health coverage. Everyone, everywhere. We want everybody to access health at wherever the person is based without any financial restriction. That's why some of us are a bit concerned and worried if the story which is trending about this small child is true. I hope it is not true. So that's what I will say for the meantime, whilst you all wait patiently to know the outcome of the investigations taking place.
But while we don't dwell on perhaps what may have led to the decision of any medical professional to take the oxygen machine from the patient in itself, can you relate with such scenarios in which patients don't have money to take care of their bills, and so sometimes such circumstances lead to their deaths?
So that's why I say that if you look the theme of this year's World Health Day, that's exactly what we are talking about. Nobody should be denied health or step as no money to pay. Health is a fundamental human right. More especially, stopping oxygen, which is on the patient. The doctors don't take off oxygen because they want the patient to die. once you take the patient into your hospital, I don't want to go deep into the merit of the case. But once the patient is in the hospital, it becomes a responsibility. If for one reason or the other, we don't even have the resources to manage the patient, that's both financial resources, logistic resources, or human resources to manage the patient, we move the patient to the next level of care where the resources are available. The patient receives care. But once the patient is in your facility, ethically, morally, and legally, the patient is your responsibility, irrespective of if the patient has money or doesn't have money. So that's how our profession works.
Okay, and before we let you go, could it be, or can you conclude then that perhaps maybe the media is misreporting the issue?
Hello?
So can you make the conclusion that perhaps maybe the media is misreporting the issue?
I'm not saying the media is misreporting the issue. The media reports what they hear. So if somebody has come to report to the media, and the media is reporting what they've heard, it's up to us to look into the matter critically and then come to a conclusion, so that we also will then inform the media that this is the circumstances which led to this. So that's what I would say.
Well, thank you very much. We'll be speaking to Dr. Nsiasare, the Director General of the Ghana Health Service. But it means that he has a great point there. The doctors have certain guidelines by which they need to undertake their trade.
Well, he has, like in my earlier comment, they have, but the paramount is the health, the survival of their clients, and that is what he rightly said. And so now it is assumption. We haven't gotten the final decision. I just hope that as the enthusiasm that we are communicating now, when they get the final report from the investigation, it should be communicated the same way, so that people are reassured that the health sector is doing what they're supposed. It's their mandate, and providing service to the Ghanaian population is the responsibility of Ministry of Health and Ghana Health Service. And that is why when it is not working or we are not getting what we need, people come out to talk about it. Talking about the issue is very important. I mean, we cannot keep quiet. People need to draw your attention to what you are doing. In the same way as they perform, when they are doing well, we must praise them. I mean, if there are gaps, we must come out and see how we can address the gap. That is why health is for all, and you must be responsible, and we must work together. It's a multi-sectorial approach. One person cannot do it. If they provide it, we must also play our role. And so that is why we are all talking about this, and it is really taking it in good faith, and we see how we move forward, especially with the president's agenda that he launched yesterday. I took my time reading through it, and I realized that he's talking about health, child and family welfare, health for all, and all those things. It is very important that what the president launched yesterday is put into practice by all, and it must be communicated to the lowest level, not only those of us who are here, but the community. Somebody who cannot speak English must understand, and that is where we are not doing well, communicating to the grassroots.
Okay, we have to end the conversation, but before we do though, let's hear from Stephen Techiansa. He's the Archdiocesan Director of the Catholic Health Services, also on the same subject.
Tell me how your reaction towards the story when you heard it. When I heard the story, because I don't have full details, I said, no, if that be the case, the best thing for us to do is to get the full facts of the case. And to get the full facts of the case, the best thing for us to do is to constitute an investigation panel, so that when the panel have done their investigation, they will be able to submit their full report to us to make us to help us make an informed decision on the whole issue. When we had the problem, in the first place, what I want to tell you is, as a Catholic health institution and as a Catholic church in general, we are pro-life. So anything in connection with life, we attach much importance to it. And for life, for somebody to exterminate life is something we don't countenance, except of course if it is for life saving. If it is not for life saving, we don't countenance that. So the moment we had the issue, we've constituted a high powered panel to go into the case and find out and bring us a report on it, so that based on the report we can see the way forward.
So tell me the preliminary things, maybe orally, what they've been telling you.
Okay, when I contacted them, what they told me was that the child had been referred, but then they were still in the hospital waiting for the relatives to come. Yes.
But as to whether the oxygen was taken off the child or otherwise, you are not unable to tell?
No, that one I cannot tell because I wasn't there. Yes, I wasn't there at that time. But all that they told me was that the child had then been referred, but then they were still in the hospital waiting for the relatives to come. As I said, in fact, seriously, we are pro-life. And anything dealing with life, our concern is the life must be protected. The life must be protected to the extent that...
Okay, so let's draw some conclusions on this. It looks like everybody is in line, and now it's the investigations that would go on. But for you, civil society, when you work with medical professionals, how well do you coordinate your activities in such a way that you make the healthcare services and also the patient become the focal point around which you do your discussions and communication?
Yeah, civil society, we are the voice of the community. We are part of them. We work basically at the grassroots. Even though we have the national and policy level, most of the policies of Ghana Health Service, civil society in one way or the other has been involved, and we try to make input and bring community perspective into most of the policies. Implementation of the policy is where we have a problem. You know, we are part of Ghana Health Service in that we try to play our role as CSOs. Something like this, putting together a committee, the right thing is to maybe let at least somebody from civil society be part of that committee and come out, because communicating to the people is very important. And because the community know that you are working with health people also, they share a lot of their challenges with you and they expect you to communicate, and so you become like a liaison between the community and the health facility, despite the fact that they have nurses at that level. And so what we want to say is that whatever Ghana Ministry of Health is doing or Ghana Health Service is doing, they should bring civil society on board so that we work together. We are already doing it. There are certain times that they think that CSOs might not be necessary, but to me, and for the interest of the community, civil society is very key when it comes to some of these discussions.
Well, thank you very much, and thanks for passing through. We're grateful, and we know that we can always call on you when we need a lot more help to mainstream discussions on the subject of health, access to health for patients, and also how well we're doing as a country. So we have had in the studio Mrs. Cecilia Senoo, who is the Executive Director for the NGO Hope for Future Generations and a member of Non-State Actors Ghana, a health coalition, is a health advocacy coalition, and you can get interactive. Please let us know what you think about this. Let's also know what your experiences have been as you get interactive with us on Facebook, JoyNews on TV. Please watch us live through our regular channel, Major Online TV.